and spiritually, so that we take the positive lessons from this environment. Even let's have some learnings. For example, because most of us are Christians, the churches are not opened. But this has reminded us that we people, we are the church.
Correct.
So we are the church. So let us use all technology for us to even maintain our spiritual well-being.
Hello, viewers. 2 weeks ago, we started discussion on the present situation in the society, which is COVID-19. And just because we want to know the facts about this coronavirus, today with me in the studio, I have Dr. Ateno Mbikan. Dr. Ateno, can you hear me?
Hello, everybody.
All right. And again, I have with me another special guest with us today, Dr. Tukes Shogowawa.
Yeah, good evening, everybody.
And with me again, I have Pastor Uchenna Uwaifo. Pastor Uche.
Good evening. Good evening.
And again, with me in the studio, I have Ngozi Ochuba.
Hello, everyone.
Hello. You're welcome again to this program, Opinions. We started this discussion about 3 weeks ago, and we decided to continue on it because almost every day we receive new information on the issue. But like last week, I know we had another guest who's also a doctor, and today we have another guest who is also a doctor a medical doctor in our midst. And like I did last week, I still want to do the same thing with Dr. Shogowawa. I will be happy if he can still tell us some facts, because at the moment we are not sure of everything about COVID-19. But because he is a medical doctor, and I'm very sure he must have he knows some things that we might not really know, and that is why I'll be throwing this question back to him. Dr. Shogowawa, if you can tell us some things that you think we might not really know about this coronavirus.
I think that's a difficult question to address, but I will make some assumption. I listened to the program last week, and I heard Dr. Adisa describing the COVID-19, which is caused by the new coronavirus. And she had described the symptoms. Now, my background, I'm a specialist in public health, which is where the epidemic control, that is my area of specialty, rather than the treatment of people who are infected with COVID-19. Just as was mentioned last week, COVID-19 caused by coronavirus is a viral disease, and there was discussed about it actually affects mainly the respiratory system. And that's why you also have these people, if you hear people on ventilator or oxygen or respirator, because the virus actually attacks the respiratory system, and that is why usually through the mucous membrane, that is nose, throat, and then goes to the respiratory system and the airways. It can also be caught by the conjunctivitis, which is the eyes. And that is where this bit about sneezing, coughing, and all that. Now, the other bit is the jury is still out, but there's beginning to be suspicion that people can actually infect others, even if they don't have symptoms. The usual symptoms, fever, cough, sneezing, and they're beginning to even say that we can actually have some of it in the gastrointestinal tract. Now, why this is unique or it is new is because it looks like it has actually mutated, because we've had coronavirus with us in the past. I'm not sure if some of you've seen it. I've looked at it, one of the Dettol bottles that we used to have. You can actually see that they say it's effective against corona, but not against this particular one. So we've had corona with us, especially amongst animals. And Dr. Adisad now talked about it last week, about it now crossing that barrier affecting humans. And there's been so many theories for it. But the main thing really is to know, is a nutshell, that we have the COVID-19 with us. It's a virus disease. It is there is no vaccine against it. It's like the flu, part of the flu family also that we've had. And we've had SARS before a few years ago, where I was even involved in some of the management of that when I was still in full practice. Now, this one is almost like a new mutation of it. So because we don't have any vaccines and all the antiviral, because it's a virus, antibiotics does not work against it. Antivirals that we have so far, we don't have any treatment, they do not work against this disease. So that is where we're in this situation where there is no treatment, there is no vaccine. The only way we can then prevent it is try and reduce infection. And that is why we have in place social distancing, self-isolation, self-quarantine, borders being closed. And this is all because we're just learning about it. The first experience started off in China and it's now moved all over the world. For people who may not know, it wasn't called a pandemic at the beginning, because in public health, we define pandemic when it has gone across different geographical boundaries and borders. So initially, it was a disease, an epidemic within China before it started moving around, and WHO declared it an epidemic in February. A pandemic, because this is now pan across country all over the world. So in a way, I hope that's helpful to listeners.
Very well, sir.
Yeah. Thank you. Thank you so much. We really enjoyed that. Okay, I would like to introduce Dr. Deden Bikan to the panel as well.
Thank you very much.
Yeah.
Thank you.
All right. Thank you. I know last week you had a question, but probably later we might still come back to that. Yeah, thank you so much, Dr. Tokes. Yes, that is the facts, the medical fact that all of us we've been trying to understand all this while. But today we still want to talk about the lockdown issue, and we want to talk about the mental health issue regarding to the lockdown. If I say talk to Ngozi, please, what can you tell us about the medical issue associated with this lockdown?
Medical.
No, sorry, mental health issue. Sorry.
All right.
Pardon me for that.
I had to reiterate that word medical because Lord knows I'm not a medical expert.
I know.
But I think when it comes to mental health, I'm not an expert, but the little that I know, it has to do with capacity. I think a lot of us are going to struggle considering, like Dr. Dide said, we are not used to being isolated, so this is a new normal for us. And I think it has to do with us being able to adjust to the new situation that we found ourselves in. Isolation is going to be one of the biggest ones that a lot of us are going to be experiencing. We're not used to being in our houses. So isolation is one that we're going to struggle with. Then you have people who already have mental health illnesses like depression and anxiety. This is going to take it to a whole new level. So, and that's why you keep seeing people saying, reach out to your friends, reach out to your neighbors, when people are acting out or people are not calling you as often as they do. It doesn't necessarily mean, oh, this person doesn't want to speak to me or they don't want to reach out to me. They probably are battling with their own issues. For someone like me, I used to think I was an extrovert in every way, but being indoors is bringing out the introvert in me. Wanting to be indoors all the time, even with the whole go out once a day and exercise. I don't want to do it. I just want to be in my house and not go out. Even when I go out, I feel like I shouldn't be out. I should always be indoors. So I think we all have different things that we're going to experience, and I think this is where coping mechanisms now have to be established. How do you cope? What do you do to exercise your mental health? Is it cooking? Is it running? Is it just whatever it is that helps your mental health? Is it meditation? A lot of people have spoken about meditation and how it's helping them. Some people go on YouTube and listen to like meditations, and apparently it's been of great help. So going back to your question, what mental health issues do I think will arise? I think one of the ones that I think we're going to experience most is isolation.
Right. Thank you, Ngozi. If I throw the same question to Pastor Uche.
What the mental health impact
on the lockdown situation?
Well, it's like people are being put in prison, to some solitary confinement, if you will. But it all depends. But majority of people, according to some news feeds that I've monitored, are all in agreement that it's like it's like they are in prison, and the only thing people can do now is just eat. As you know, in mental health, when I'm not an expert, I'm just quoting our brother Ejiro, what he taught me at a point. He said when somebody just continues to eat and and not even care of his health or the impact of the overeating and weight, he said that constitutes a mental health issue. It means that the person is not mindful of the weight and health and safety. So what I'm trying to say in essence is that a lot of people are piling up the weight now, which will be a mental health issue later if it is not already now. And not being able to see who to talk to. A lot of people are lonely. They are so lonely to the extent that they cannot, because you cannot go out actually, and not everybody are versed, in this new IT means of communication, internet and the rest of them, not everybody. So you see a lot of people lonely, at home, just talking to themselves, and talking to oneself is first degree in madness, so a lot of things like that. And so that will be all for now. It's not easy anyway. What I'm trying to say is it's not for us. I go to work. I still work. We still work. We are into distribution, so we distribute. I work with FedEx, so we make sure hospitals and pharmacies, pharmaceutical companies get their whatever they ordered for and the rest of it. So we are considered essential. So I still work, I still, hold fellowships remotely. I still make phone calls, international and local and all that. So as you can see, it has no impact on me anyways, like every other day thing. But I know we are not all the same. To some others, they are lonely, and it should be looked into.
Oh, thank you. Thank you. Dr. Atsi, I think yesterday or about 2 days ago, I had the opportunity of going around. Actually, we've been asked to, we can go out for a particular exercise a day. And I think yesterday I started my own walk exercise, which I have not been able to do for a while. But I was so surprised to see a lot of people outside. Do you think this is right for people to do?
Well, it depends on what they're going out to do. Obviously, it's not everyone who goes out that is actually going out to take exercises. If you look back from when this lockdown started, you will note that you had fewer cars on the road than it is now. Maybe because the weather is good, we've got some sunshine, so people just want to, go out and enjoy the sun. It could also be that they are already tired of staying in the house, I know that staying in the house, it's a way of keeping yourself safe and keeping others safe as well. But sadly, some people don't want to listen to that. People are still gathering, people are still, being in clusters, working together in clusters like that. So I don't think everyone is going out to exercise. It's okay if you're going out to exercise. It's okay if whilst you're outside, you're still, practicing the social distancing thing, But if you will just leave yourself like that, take for instance now, if you follow the news, you'll find out that at a point, we started going down. We had 400 and something deaths, 600 and something deaths. Now it has gone back to 800. We do not know why that is happening. So I think it's still good for people to listen to the authorities, stay back at home if you don't really have an essential need, So that's all I can say for now.
All right, thank you.
I hope that
Dr.
helps.
Dede.
I can hear you.
I'm
Yeah.
back.
All right. Okay.
Can you
Yeah,
hear
welcome back, Ngozi.
Sorry.
I will come back to you. I'll come back to you later. Sorry.
I don't know what
Thank you.
happened there.
I understand. Network issues. Thank you for rejoining in. Dr. Dede, there was this video that I watched recently. One of the religious leaders, he was advising the government to leave this, to stop, to end the lockdown. And he was advising the government like people seems not ready to be ready for this situation. Do you think that is a good step for that person to take?
I think that first of all, that question should have been thrown to Pastor Uche. I am not a pastor, and who am I to judge a religious leader? I don't know what his authority is and where he's coming from, but perhaps he has a spiritual insight to the problem. Unfortunately, that is not the way the world look at things. Okay, the world look at things from a scientific point or perspective, if you like. Okay, and so I wouldn't really be able to answer that question whether whether the pastor is right or not. But what I will say is that I think the pastor probably is a person like me, and he is, of course, and I'm worried, okay, because you have asked us to stay at home, and the numbers are not going down; they are fluctuating. But the average is that it's still going up. They told us that it's flattening. They haven't told us. I'm not anti-government, but just like any rational human being will think And just like any rational, normal human being will be tired, because we are not wired to just sit at a place in a confined space. That is like prison. Anybody, any natural human being will react to such a situation.
That's right.
So I am as worried as the pastor, and if I have a flock under me, I will say something to encourage them. But when you listen to the news and the daily briefing, as a matter of fact, it's like, going around a cycle. One day we are told that at the middle of May, we should be expecting to go back. But at another point, we're saying that, look, this thing might even go before, far more than the end of June. So there is no encouragement, no specific, at least if we are told that the numbers are going down by keeping us at home, we'll be encouraged that it will get to a point where they will also tell us that as soon as the number gets to 300, then I think we are safe to start, opening up some aspect of the economy. So I really don't blame the pastor. Maybe the Dr. Tukumbo, who is more scientific in this matter, will be able to throw more light to that. But I'm as worried as that pastor. And if there is no discipline, I'll be tempted to say the same thing to my pastors. To my flock. Especially if I've got some sort of spiritual insight to the problem.
Dr. Tugs.
Yeah.
Yes, sir. There is this question that I want you to help us to clear here.
Okay.
This COVID-19, let's say coronavirus, is termed as virus.
Yes. Yeah.
And we have been advised to use different disinfectants to spray on objects, probably Angel. I think an Angel is also antibacterial or something. I'm not really very sure. But please, can you help us clear the issue between virus and bacteria? And those disinfectants, are they the right things to use in order to control this virus?
Okay, right. Just as I said, this is a relatively new virus. It's a new variant of existing viruses. And if we recap, we've had different outbreaks in the past. We've had the Spanish flu 1918 to 1918. We had the Asian flu in 1957. We had the Hong Kong flu in 68. We had the swine flu in 2009, 2010. We had the Middle East, which we call MAS, Middle East Respiratory Syndrome, in 2012. We had the seasonal flu epidemic. We always have the, as you know, we always have the flu every year. We have vaccine against it. Now, the virus, the difference between a virus and a bacteria. Bacteria is bigger. You can see bacteria on the microscope. But for virus, you need electron microscope. It is small. Now the viruses are they have no cellular structure, unlike bacteria. And they are covered very thin film, which is a bit fatty. So we don't have anything, antiviral drugs, we don't have any, like I said, we don't have any against them right now. But even if we do, it can only just slow down the reproduction of viruses. Virus need a living cell to thrive. And that's why when it comes out in the body, out of the body, and it's on the body on some surfaces, it dies after a period of time. Now, your question about the bacterial hand wash, that is why, because it has a thin film like a fatty issue, that's why washing with soap and water for 20 seconds is the most effective. It is washing. Now, if we're going to use hand wash, we need the alcoholic content must be at least 65%. Most of our drinks and tolerance, I'm sure you know, the alcoholic content in most of our drinks are not up to 40%. So I know there's a Russian one which I have, which I've just looked at, is almost 70%.
Vodka.
Yes, it's a Russian one. So really, that's why hand wash or hand gel that has alcoholic content, at least 65%, can then work on that fatty issue, or soap and water after washing for 20 seconds, it will break off all those skins. And I mean, all the skins, surrounding the film surrounding the virus. And those are the most effective. But in absence of those ones, the advice is at least use the gel, but as soon as possible, wash your hands. Even with the alcoholic gels, the most important is still the washing of hands. And this coronavirus epidemic or pandemic is actually now taught us the things we are taking for granted. Everything we talk about, hygiene, simple hygiene of wash your hands when you've done anything, wash your hands before you go into that, wash your hands every time. The only thing now is because you're not doing it every time, issues about your skin, the cream to use and all that has to come in. And for our ladies who, well, maybe I'll make some savings now, they won't go and do false nails, long nails, because that is where it is difficult to wash and things can actually hide there. So part of the advice is keep your nails short. Because when you're doing the hand washing, there are bits about where you actually have to do it. I'm sure some of us will have seen all the video and all that. If you have very long nails, the one you're going to do within your palm like this, and that will be very difficult. I don't know how people with long nails will be able to do that, for example. So that is the that is the difference, with virus and bacteria. We have over almost 99%, according to literature, of bacteria are not harmful. They are harmless to us. If anything, they actually help us, in doing breakdowns within our body.
Thank you, sir.
Yeah.
Ngozi.
Yes.
Yeah, there was this question that I threw to Dede the other time, and he said it's nothing. I think Pastor Uche is trying to join in now. But if you could just say something about it, because I'm very, very interested in that question, and it's about someone asking the government. Can you hear me, Ngozi?
Yeah, I can hear you.
Asking the government to end the lockdown. That is not the right thing for the government to do, and that people are not ready. Must we be ready to be on lockdown?
We have to be ready to be on lockdown. I want to go back to what Dr. Tokumbo said. Dr. Tokumbo made a statement where he said that in order for the virus to thrive, it needs a host.
Yeah.
It needs a living host for it to thrive.
Yeah.
That statement in itself is enough to tell any sensible individual, whether spiritual, whether a person who is non-spiritual, a scientific person, to understand that it's a matter of life and death right now. Whether you are symptomatic or asymptomatic, for you to be a living host for that virus to thrive, you have to be alive. And then in order for the virus to leave you, it has to kill you. So it's more or less, it makes too much sense. That statement Dr. Tokumbo made is just enough to explain to any sensible person that you need to stay indoors if we know that we want to go back outside.
Yeah, but my question is, someone is asking the government to end the lockdown, that people should be allowed back into the society to start doing their normal day in, day out activities, which I think is not safe at all. So do you, yeah, all right. Pastor Uche, are you here, sir?
Yes, please.
Okay, please, what do you have to say to this? because
Sorry,
the person
I
that
didn't get
made
that.
the video happened to be a religious leader.
Okay. And what did he say?
He said government is doing the wrong thing, that people should be allowed back into the community, and that's why should they choose lockdown as a measure to control COVID-19, because nobody is ready to be on lockdown. Must we be ready to be on lockdown before we are asked to go for lockdown?
Well,
And do you think we should be back out there now when the thing is not yet well controlled?
okay, I'll speak for myself because the Bible says the spirit of a prophet is subject to him. So the man of God is talking from his own side. I think it's an health safety issue. It's a safety issue. So if the lockdown can take 500 years for us to be safe and alive, it's only the living that complains. Dead people don't complain. That is one. Secondly, the issue is planned. That's why they in the parliament, they're asking the health sector and the rest, exit strategy. Are we going to be on this lockdown for how long? There's got to be a plan. That is the first thing. You know, when you are hungry and you have hope that in the next 3 days that there will be supply of food, you can't die from that hunger. So we just have to know the plan. That's all. But otherwise, I think if it takes forever to be alive, in eternity, there is no time in eternity. So anybody that has died has entered its own eternity. We are still living, so we need to live. So the best thing is for us to obey the health experts, their advice, the government. God enjoins us to obey the government, not when they are doing wrong, because when they are doing wrong, you can do a kind of righteous rebellion. But once you see that this thing is all right, what they are doing is all right, we just have to go by their advice. Thank you.
All right, thank you. There were some videos that we saw them recently regarding the way the Black people were being treated in China regarding this coronavirus issue. Dr. Dede, please, what do you have to say to this? Do you think this is the right thing for the Chinese people to do, especially maltreating the Black people the way they did?
Well, I don't think that it is the right way to treat anybody, whether black, yellow, green, or whoever the person is, irrespective of the person's social status or economic, background. In this 21st century, it's absolutely absurd to see, that kind of treatment. Okay, but I don't really understand the reason why blacks are being treated like that. I've seen a few of those videos, and none of them has actually explained why the Chinese are treating Nigerians like that and other black community. Okay, but I think the closest I got to know as a reason why this is happening is the fact that they claim that blacks are those carrying the virus, okay, the coronavirus, or the new outbreak that we hear is almost in the air. Okay, and I'm tempted to think whether Nigerians have become the animals that we are told at first that they ate, and it's not funny. Okay, I'm not trying to take us back to the conspiracy theory or the etymology of where all this, that's not where I'm going. What I'm saying is that the Chinese people will have to be called to order and really find out what their problems with the blacks are. If they don't want us in their community, that is not the way to go about it. There are better ways. Tell our leaders to come and take us home, or you deport us like other nations have done, deport us back to safety and don't leave us in the street, as even animals these days don't stay in the street. So why would you treat any human being like that? It's absolutely unacceptable.
Can I comment on that? Can I comment on that?
Yes, please. Yes, please.
So this COVID-19 situation has brought challenges to governments all over the world. And different governments have attacked, they've managed this differently. And different governments have different approaches, they have different policies and different laws and levels of liberty or individual rights. I mean, myself and we were in China in November. We were lucky just to be out before it happened. China is a place where it is complete, everywhere is monitored. There are so many millions, I mean, the guide was telling us almost 2.something million cameras. So that brings some safety, where you can leave your bicycles, they are not locked, but you pay a price for it. There is that's not fair. The degree of privacy is limited. So the government has control. The news are filtered. We couldn't access Google. Now the situation in China is very unfortunate. I actually have a colleague who has 2 children there who went to uni, and one has a business. Now the senior one who's a business is stuck in Nigeria. He went for a business meeting and could not get back to China, but the brother is there. What happened was that we have quite, not just Nigerians alone, a lot of foreigners, but blacks who are there, whose either their papers are not sorted out. So being invited to come that was where the problem started, being invited from this side of the story, that's why, being invited for testing. But because everything in China is linked, once you go for testing, everything is linked to all your bank details, your immigration status, and it's almost a cashless, country. To get toilet roll from the toilet, you have a card. We couldn't use that. So because of that, they discovered that foreigners were not coming out for testing. And there were 3 cases. The one that actually led to this, in that area that this my colleague's son stays, one unfortunately is a Nigerian, escaped, ran away from the isolation center, and then ran into a group of Africans where they protected him. And what did the security, and they just descended and they just packed everybody. And you've seen videos even when they had their first phase, the way they even treat their nationals, dragging them almost, it's like by force. There isn't that liberty about this one. We are saying people should stay home, self-isolate, and people are going out. And people are here in Cleveland, we advise before we enforce, before we fine. In China, that doesn't happen. There's even, anecdotal reports that some people were actually sent into camp, and what happened to them, people don't know. So it's unfortunate that we are in a country in that kind of a structure, and we've got to learn, and there are reasons for it. But then, if you then give them the opportunity, these are people even without reasons. They are very high-handed. You can then see where they now have a reason, they will be more high-handed and they will just close everybody together. This, my friend's son, actually was invited for test. He said they came to pick him, took him for the test, and brought him back. So there are those 2 sides to it. Okay, the other thing I just wanted to mention about this lockdown is there is the public health aspect of that, to say, look, this is how the government has to contain it. Some other countries did not do lockdown. They're doing social distancing. Taiwan, that they've given, WHO has given examples of 4 or 5. But this is the policy that the government has decided. The Public Health England has an action plan where they have 4 stages, which is contain, delay, now that they research, and then there's the mitigate. So asking the government is, okay, what is the next plan? It's difficult for them because next plan is informed by the information, the data they get based on the reaction, because people can't predict it. And that's why they've said, oh, we seem to have gone down, we're now plateau is going up. Because they haven't included deaths from care homes. Nobody knows how this virus is going to react. Nobody knows whether we will develop immunity once you are infected. And until we have a vaccine, we actually cannot be very sure of what will happen, because vaccines is what we use for us to develop immunity. And if you look at flu, we get vaccines every year for those in the vulnerable group. So even if you get vaccine, if it's the same like flu, you can only get some protection for about 1 year. And that even doesn't mean that you won't get it, you just limit this. So we are dealing with a very strange virus, a very strange situation, and we're still learning. And the experiences in the different countries are different. America, you know what's happening. Initially, when we started, we did not have any blacks. And we thought, oh, maybe there's immunity that in our genes that is preventing us. Now they are saying because we have malaria in the malaria endemic areas, maybe that's providing some level of immunity. But we've got to recognize we are not testing, say in Africa, as much as in the westernized countries. If you then look at why in New York, why do you have so many Black and Hispanics and all that, more than the others? Or even the Blacks, healthcare workers, almost all of them who have died are Blacks and Asian brain group. And so we still have a lot of questions unanswered. And that's why it's difficult for the government to say, this is the next time. If you ask my opinion, we're going to have this for the whole year. That is me.
Thank you so much.
That's not good news.
Because of our time, we only have a few minutes left. Please, if I just ask us one after the other, what we can tell, what we can say to people that are watching this program at this moment, and how we can encourage them to be able to cope with this situation of lockdown. And if I should start from Pastor Uche, please, if you can just advise people, what can you say to people from the spiritual perspective on how people can cope with this situation of COVID-19 lockdown?
Well, we know from the spiritual angle that, man, can you hear me, please?
Yeah.
Can you hear me?
Yes.
Okay. Yeah, I can hear you now. Yeah.
All I can say is that let's just keep praying, trusting in God, taking every necessary precautions as advised by the health experts, and don't let it get to our heads. That's all.
Dr. Ati, what do you have to say? We haven't got so much time again.
What I can say is be safe, protect yourself, protect other people, keep washing your hands, as many times as is necessary, and do whatever you like, what will make you happy. If you like to DJ, you can DJ. If you like to.
Doing it already.
Okay, that's what I have to say.
Dr. Dede.
Oh, well, I will say that we need to develop that, discipline, that inner discipline. We need to cultivate discipline wherever we're going to, however we're going to do that, we need to, because it's really, really easy to get into a lifestyle that will not help us later when this thing goes off. We need to stay alive now. We need to stay to see the back of COVID-19. So if you're drinking too much, you better discipline yourself. If COVID-19 should not be used as an excuse to do those excesses that will lead to regret. Thank you.
Ngozi, what have you got to say to us, please?
I think it's the same thing we've been hearing every day. Stay home, stay safe, Everybody has literally said the same thing. I think we need to, in order for us to be able to go out, we all need to be indoors for now. Adhere to all the instructions that have been given by health experts and just do what is right. If you don't need to go out for essentials, please stay home.
Thank you. And Dr. Tuggs.
Well, everybody said so, and I think I'll just...
Hello?
Yes, can you hear me?
Yeah, very well, sir.
Yes, I heard.
Okay.
It's the bit of... it's unfortunate we're in strange times, and everybody said that we need to be disciplined for our physical lifestyle, mental, the things that we enjoy to do to help us be in mental health well-being, and spiritually, so that we take the positive lessons from this environment. Even let's have some learnings. For example, because most of us are Christians, the churches are not opened. But this has reminded us that we are the church.
Correct.
So we are the church. So let us use all technology for us to even maintain our spiritual well-being, whether we are Christians or Muslims, whatever. So physical, mental, and spiritual well-being is key, because we don't know
Thank you.
how long this
Okay.
is. Now, don't say because we don't know for how long we're going to be in this. I'm sure it's going to be in stages. Yeah.
Okay. All right. Thank you so much, sir. Thank you, everyone. And until another time, does anybody have anything to say aside that?
After party.
Okay. All right.
Recording party.
I can't wait for this lockdown to come to the end so that we can do that.
Yeah.
And thank you all for being part of this program today. And until next time, and again, my name is Tola Shidayaba. Until another time we come your way, this is Opinions. Thank you. Bye for now.
Thank you.
Thank you.
Bye.
Bye, everybody.
Bye.
Bye.
Bye-bye.